Hi, I'm Kristin Pelletier, founder of KP Consulting, where we help dentists reduce stress, increase profitability, and create a practice they love. And today I want to talk to you about a topic that I'm very passionate about, and that is keeping your patients active in the practice. One of the reasons I'm so passionate about this topic is I see behind the scenes. I see what dentists are spending on patient attraction, what they're spending on their marketing to attract patients to their practice. So when I see that they don't have the back door of their practice closed and that a lot of those dollars are bringing people in one door and out the back, I really want to help them understand that there is a solution to that problem. So before you invest thousands and thousands of dollars on a new marketing plan, look at your current patients and see how effective your team is at keeping them active in the practice. Now, I've been in dentistry my entire working career, and so I know personally that in the past I have done a terrible job with this system because I didn't know how to do it. And I can remember years and years ago being in a practice, and my recall system looked like this. I was very, very busy, and anytime I had downtime, which means everything else was done and caught up and there was absolutely nothing else to do, that would be the time that I would focus on continuing care or recare. Now, I would send out my postcards and do the, just the routine tasks of making sure that patients receive their notices. But as far as really picking up the phone and having a systematic way of reaching out to these people, it didn't exist. And I'm telling you that in full transparency to say that a lot of offices are handling their continuing care system the very exact way. So my recommendation to you is that you have a consistent protocol for communicating with your patients to keep them active in your practice. You'll want to determine what interval you would like to communicate with them and also what mix of communication methods you'd like to use. You have electronic communication, whether it's text message or email. You also have snail mail, which would be a letter, and then there's also the phone calls. So how often, what mix of methods are you going to use, and then put that system in place like clockwork. So any patient that hasn't been into your dental practice, let's say in a year, you can look at their record in the computer and their notes and see that we've communicated with them on the same frequency as any other patient, and that they're not just falling through the cracks. It is amazing to me at the results from a solid continuing care system, what that looks like in a dental practice compared to the method that I used, 15 years ago, which was when I had time I worked on it, and if I didn't, it would fall to the wayside. I encourage you to examine your current protocol, and if this is something you'd like for me to help you set up, visit my website, kristinpelletier.com, or you can also call me to set up a complimentary consultation.